Hi, this is Dr. Mary Kathleen Figueroa, welcoming you to the Thyroid Channel. Thanks for tuning in. This is for educational purposes and for entertainment. If you have specific medical concerns, please contact a local physician. First, let's talk about what is the thyroid. The thyroid is a butterfly-shaped organ in your neck that perhaps helps you to do most of the things that you perform per day. It is a generalist hormone, which means it does most things, it helps with most things, and has no specific effect. So for instance, it helps to speed up your heart, it helps to help your blood vessels contract, it helps your kidney and your liver to excrete toxins. And so without a thyroid, you would simply slow down, your heart rate would get slower and slower, and ultimately you'd go into a coma. So the thyroid is very important in your body. So what are the symptoms of hypothyroidism? We talked about the slowing down of processes. More specific to the thyroid is actually changes in your menstrual cycle if you're a woman. The thyroid lack of thyroid function causes your ovaries to work less well, your ovulations to be less frequent, and your menstrual cycles to be crampier and more painful. More general effects are fatigue, changes in your hair or changes in your skin, changes in your eyesight that are very subtle, changes in your cholesterol levels. So while many things can cause fatigue and many things can change your level of alertness, thyroid is one of those causes. And what are the causes of hypothyroidism we're talking about? Hypothyroidism is most caused by Hashimoto's thyroiditis. So thyroiditis means inflammation of the thyroid, and the thyroid is inflamed because the immune system goes after it and tries to kill cells in the thyroid. The immune system is usually very wise and distinguishes between cells and processes that are you and that are not you. So for instance, if you had a viral infection or bacterial infection, your immune system would attack it and kill it. Likewise, if you have a cell that de-differentiates, so becomes like a cancer, most commonly the immune system will seek and destroy it. So that's why we don't all get cancer by age 20 and die. So Hashimoto's thyroiditis is inflammation that your immune system causes in your thyroid, and ultimately, if it goes on long enough, it can cause loss of thyroid function. But only about 50% of the people with Hashimoto's thyroiditis actually get hypothyroid. And that's because the body has a way of making more thyroid cells and making more thyroid hormone. So as the immune system kills one cell, then your body can make another cell and you can maintain your thyroid function. So what other causes of hypothyroidism are there? One other cause that counts for the 15% is when people have their thyroids taken out for either goiter or for surgery for cancer. And lastly, some people are eating less salt for health reasons or using other types of salt like Himalayan salt or sea salt from the Holy Land or wherever they're getting their salt. And that salt is not necessarily iodized. Salt has some iodine in it naturally, but the U.S. government asked that salt be iodized so they would have sufficient iodine to keep people who did not eat fish or were not near oceans from developing goiters, which are enlargements of the thyroid. So if you eat a particular diet that is low in salt and don't much go to restaurants, you might actually develop iodine deficiency, and from that you might develop a low thyroid function, because iodine is necessary to make active thyroid hormone. So we've covered what is hypothyroidism, what are the symptoms of it, what are the causes of hypothyroidism, and specifically we've talked about Hashimoto's thyroiditis. Tune in for the next video where we'll discuss Graves' disease, the other side of the coin, hyperthyroidism. If you like this video, please give it a thumbs up, and if you'd like to subscribe, please look below. Thank you again for joining our Thyroid Channel for discussion of hypothyroidism.